If you want to prevent heart attack, then you should walk as per your exercise tolerance. Either you walk 25 to 30 minutes per day on empty stomach, and if you are diabetic, then add on 500 steps after taking a meal or dinner. And if you walk 45 minutes on alternate day, 3 days in a week, that's okay. But you have to walk. Second thing, obesity is the biggest factor that is the main culprit in aggravating heart disease and aggravating heart attack. Childhood obesity. From the childhood till adults and adult type people eat processed food like pizza, burgers, French fries, bread, white breads items or brown breads item. In brown breads also there is a lot of maida. Cold drinks, packaging fruit juice, sauces, athana, papad. People don't want to eat natural food in raw form. That is the biggest mistake to create blockage. आपको अलग अलग जात के नुस्खे बताए जाएंगे, इसका रस पियो, दूधी का रस पियो, पोमेग्रेनेट जूस पियो डेली, बीट जूस पियो. आप ये भी कर सकते हैं कि भाई हफ्ते में ऑल्टरनेट डे हर एक जूस का ट्राई कर सकते हैं. सपोज वन डे यू टेक दूधी जूस, सेकंड डे पोमेग्रेनेट जूस और बीट जूस. You can take gajar juice, means carrot juice. But I would like to prefer that you should take all the vegetables first in a raw form and then in a cooked form. So if you want to reverse the heart disease and diabetes and insulin resistance and obesity, then you have to walk and eating a food in a natural form. Mostly people are eating synthetic foods. Mostly, आप देखो कोई भी पर्सन की लाइफ में 80 to 90% फूड सिंथेटिक फूड जा रहा है. और सब्जियां भी आजकल पेस्टिसाइड्स वाली हो गई है, तो उसको वॉश करके आपको लेना चाहिए, बनाना पड़ता है. और एयर पोल्यूशन एंड टॉक्सिक मेटल्स that is coming from smoking or alcohol or any preservative rich packing foods creates blockages in the arteries of the vessels, arteries of the heart, brain, leg, because toxic metals are in smoke, atmospheric pollution, diesel exhaustion, particulate matter 2.5 mm. That is very disastrous to the lungs, heart and brain. It increases BP, lipid peroxidation occurs. So why right now these days heart attack risks are increasing in young people also? Because in a processed food or outside food, in a single oil oil tray or oil pan, they make things like bhajia, vada pav, or fafda or samosa or anything, the fried thing. They use same oil multiple times. They use same oil, so oil becomes rancid, and the item made in it becomes trans fatty acid rich. That is very very inflammatory. That's why it should be avoided. Then sweets are real culprits. Sweets is more dangerous, sugar is more dangerous than oil. And if you want to take oil, you can use daily 1 or 2 teaspoon unrefined oil, filtered or cold press oil, unsaturated, unrefined oil you can use for frying purpose. But if you want to eat sometime bhajia or samosa or any fried item at home, so use oil one time and then discard it. Don't repeatedly use it. Otherwise, it becomes hydrogenated products. Why these packaging products are more dangerous? Because it is used, it is fried in palm oil. Lot of salts, lot of inflammatory things are added for taste. So that's why the dietary changes is needed. You should do yoga, you should do meditation for whatever time you feel comfortable, 5 minutes, 2 minutes, 5 minutes, it's okay. Deep breathing 5 times, that is very good. Anulom Vilom Pranayam, that decrease your blood pressure, stabilize your heart rhythm, and the concept of eating outside is very much increasing, because due to westernization, people has to tour outside for business, people has to eat outside, so naturally there is a very fatty food they have to eat, or they have to eat maida products more. It is a natural things. Outside you cannot get the food like you are taking at home. But the concept is that eat homely food, try to eat raw food if you are comfortable as much as possible. And cardiologist has shown you, invasive cardiologist has shown you multiple blockage like bricks, 90%, 99%, 80%, 85%. That is their mind's judgment. It is not coming, print is not coming out from the machine. So it is a lump sum judgment. But that is not a fear factor. How much so much blockage the doctor has shown, and that you do immediately stenting or bypass. That is not a more thinkable thing. It is a business. But you have to take immediately blood test like HSCRP, inflammatory marker, drop of eye, if there is no ST elevation in ECG, then diabetes, lactate levels, CBC. So all these things to be done, kidney tests, LFT, liver function test, vitamin B23, uric acid, leg test. So you can judge your disease severity by this blood test. And in angiography, they become you panic. Whole family become panic by showing, oh, multiple blockages are there. Now what we can do? But that is not a real picture. It is a gateway to go for to take the client or patient to the angioplasty or bypass. If you have emergency, that block has ruptured, and mostly less than 40% block that is not seen in angiography is ruptured, and it can create clotting cascade, activate clotting cascade and platelets. At that time, you can go for emergency treatment like emergency fibrinolytics, thrombolytics, tenecteplase, that is fibrin-specific thrombolytic. You can, it is a 5-second dose. You can use it very perfectly and dissolve your clot. Otherwise, you can go for stenting in emergency only, you know. If patient's condition after emergency is stable and patient has no pain, and doctor says you has to go for angiography and angioplasty, then you have courage to say no, I don't want to go for, because American Heart says that after 12 hours angioplasty is useless, medicines are working better. EECP treatment that is approved by US FDA, that is the best treatment ever seen by cardiology fraternity. But it is a war, mind war between surgical and interventional doctors and non-surgical fraternity. But EECP mechanism is why authentic, because it works with cardiac cycle. Cardiac cycle is 0.8 second approximately. The 0.5 second is diastole. At that time, from leg region, in ECP there are cups applied, pneumatic cups applied in the leg, three portion of the leg, and ECG electrodes are applied on the chest, and plethysmograph, sphygmometer applied on the finger. So from leg region to aortic region, blood flow goes and it perfuses coronary arteries in diastolic time, that is 0.5 second approximately. And in systolic time, all the belts fitted in the leg are going to automatically open from upper side to lower side, so afterload will decrease. And simultaneously, if patient pumping is okay, there are methods that you can maintain venous return, so cardiac output and stroke volume increase. But if patient is congested, patient has fluid in the leg or fluid in the chest or abdomen, then you should use another protocols for the ECP. If patient has pulmonary hypertension or right ventricular hypertrophy, there are different methods to treat patients. So, take treatment by authentic ECP doctor. I am saying that I am a MD and I have done a lot of fellowship, or I have a DM or anything. But if you haven't done course of EECP, if you haven't done training in EECP, it is useless to say that you are EECP specialist. EECP is a different thing. I have seen that in a lot of stand doctors are keeping EECP machines in their hospitals, but they don't know the mechanism of EECP. They haven't deep study like they have studied like stent. So they hire a technician to run EECP machine in weak heart patients like heart failure patients and chronic angina patients. So it is EECP is an authentic treatment approved by FDA all over the world. So it is a must to take treatment for all heart patients except some severe valvular aortic regurgitation patient or DVT, deep vein thrombosis patients. Otherwise, it's a jam treatment. So you are supposed to be natural, eat natural raw food, take natural scientific FDA approved treatment, EECP treatment, take good breakfast, take good lunch, but don't take heavy dinner, and avoid any type of bad habits like smoke or alcohol to the man fraternity, and avoid outside food, walk as you can walk, and get sleep properly 7 to 8 hours, do meditation or pranayam, take medicine as per protocol to reverse the heart disease and to keep LDL cholesterol as low as possible and inflammatory markers as low as possible. That will reverse your heart blockage. You don't have to go for surgery or stenting. This is a miracle treatment. So adopt non-surgical heart treatment, allopathic medical treatment, dietary guidelines, and EECP, and detox chelation if you have calcium in the coronary arteries. That is awesome treatment, authentic treatment to treat heart disease, and you get rid of trauma of bypass surgery and angioplasty. And you have no risk of rethrombosis or restenosis like stent. You just open your blockages and you just dilate your artery, you develop natural growth factors and develop new arteries, vessels, and open dormant vessels. And by medicines, blockage are going to be decreased gradually, and with EECP due to inflation and deflation, EECP cycle, 1 hour cycle, blockage are going to be friction, and it is going to be decreased, and inflammation is going to be decreased. So adopt non-surgical treatment to treat heart disease. Thank you.